Hey everybody, how you guys doing today? This is Jim Prusak, licensed physical therapist here from the Pain PT, and I bring to you guys each week, or try to bring to each week, what we call evidence of the week. And as a licensed healthcare practitioner, done research, I really value the research and the evidence. Um, and I really try to share that with the audience here because a lot of times you're not going to read this stuff or see this stuff because it's just not out there unless you go digging. So my role here is to try to translate the evidence we have from people that are doing research all around the world into an understanding and practicality that you guys can take and use and apply to yourself because of what you're learning here. And all this is in regards to somatic symptoms we call somatic symptom disorder or chronic pain, chronic health issues that are really widespread in the world, but are being mistreated. They're not being treated appropriately. They're being treated like regular physical ailments, and they're not, right? We have so much data coming out, and I'm going to share with some of you today about emotions again that really do show the brain, the nervous system, our emotions, our mental, psychological health, emotional health is closely tied and related to our physical health. And I think that's the take home from my channel here that I try to impart to all of you. So here we go. Today's evidence of the week is about anger. Okay, I talk a lot about emotions because they're just such an important area that's under talked about. It's not an area that any doctor or medical professional usually ask you about is your emotional health, how you deal with emotions, and emotions in general. But it's such a fascinating and important area that I believe personally is the biggest area for people to look at and learn to address in themselves, how to work with emotions. So today we're going to talk about anger. I'm going to share with you guys today two studies here that really go into how we should deal with anger and what anger can do to us if we're not dealing with it well. Okay, so the first study I want to talk to is one that was done at Ohio State University, 2024. And this was a review article, which I love because these meta-analysis are powerful studies because they gather data from many, many studies, many patients, participants, and they group the findings into an overall consensus. Okay. So in this particular study out of Ohio State, 2024, they analyzed over 150 studies involving more than 10,000 people. Okay, so a lot of data here. And they looked at what really helps with anger. Okay, what really helps with anger? And the title of the article from the university, from their publication, is Breathe, Don't Vent. Turning down the heat is the key to managing anger. Now, this is going to be interesting because some of you are going to be over here and some of you are going to be over here. And what I mean by this is the people who vent, yell, and scream, get really angry and really show their anger. That's not healthy. That's not good. Okay. In the same way, if we're way over here and we're suppressing our anger and repressing it completely and hiding it totally, that's not good either, right? And this is where people live. They live in these extremes. You think passive aggressive. But with the study here, what we found is that techniques to calm the stress, and here's the key word, everybody, across the board, for all your emotions, the idea of calming down, relaxing. I use that word relaxing a lot. Calming yourself, relaxing the emotion, bringing the emotion down is generally the answer here, no matter what you're feeling. Okay, we want to decrease the physiological arousal the emotion creates in your body through the nervous system because it has a physiological effect in you. And I'll show that to you in the second study here. But in this particular study, the senior author and researcher here, Brad Bushman, here's his quote. I think it's really important to bust the myth that if you're angry, you should blow off steam, get it off your chest. We have this belief notion that get it out, get it off my chest is going to be good for me. And it's just not true. It says here venting anger might sound like a good idea, but there's not a shred of scientific evidence to support the catharsis theory. So this goes to these ideas of rage rooms and hitting things and smashing pillows and punching things is actually not effective to reduce your anger. In fact, it increases the aggressive nature in yourself. He goes on here to say that to reduce anger, it is better to engage in activities that decrease arousal levels. Despite what popular wisdom may suggest, sometimes even going for a run is not effective strategy because it increases the arousal levels and ends up counterproductive. So that makes sense, right? If you increase sympathetic activity even further, you could potentially increase the activity level of the anger. It's not actually bringing it down. So more calming, more, they always say somebody who's very angry, count to 10. Slow breathing. Pause. Remember, anger is the emotion created in your body, just like any other emotion creates a physiological feeling or effect. How we deal with it is your ability to regulate the emotion. Some people are reacting to, let's say, anger and blowing up because they're reacting to the feeling in themselves. In the same way that some people suppress that anger, they don't want to feel that. Okay, but there's a whole middle ground here that we need to learn to build what's called the emotion regulation skills, which I believe is one of the biggest areas to learn. It's one of the areas I teach with people I work with. I spend most of the time on emotions. So this whole thing here, one of the other authors here, Sophie Kadrovic, I'm not sure if I'm pronouncing her last name correctly. She was one of the other authors of the paper here. And she says here, I wanted to debunk the whole thing of expressing anger as a way of coping with it. We wanted to show that reducing arousal and actually the physiological aspect of it is really important. Okay. Again, this is a lot of data, 154 studies, over 10,000 people. So it's very strong data here. And the idea of bringing it down, not bringing it up. Okay. So things such as relaxation, progressive muscle relaxation, and just relaxation in general can be as effective as mindfulness and meditation. Okay, yoga, things like this, calming down the that. And that word relaxation, I always say to you, is the word I would pick. One word, and I said this from the day I started my practice, that the number one word is to relax. Relaxation. We want relaxation of the nervous system, calming down, settling, soothing into a peaceful state. That's when we feel our best. Okay. So hopefully you're learning this here today. You may not have heard about the study again. This is why I bring you evidence of the week, Ohio State, 2024, decreasing arousal when it comes to anger, blowing off steam, getting it off our chest. Those are old notions that's just not supported by the research here. And it's one of the other, the author again, Bushman said, some people think that when you get angry, it's a good idea to get it off your chest, blow off steam, hit a punching bag. That's just not true. Or that you should go for a run. That's not true either, because those activities increase arousal, and the goal when you're angry is to decrease arousal. There's a take home for you guys. Decrease arousal, but not suppress it either. So some of you may fall in the category that you suppress the emotion. We want to let it be expressed in the body, be able to learn to label it, identify it, feel it, let it pass while you maintain some sense of composure and control. That's called emotion regulation skills. Okay, so the ability to build emotional awareness and then to regulate the emotion is a really important skills to build in yourself. Because we know, and I'll share this another time, that from adverse childhood events or even other life events, we can have emotion dysregulation. We're dysregulated. We don't deal with emotions in a healthy, good way. Okay, so that was the one study here that I wanted to share with you guys here, is that we've got to decrease the arousal of anger. Okay, and I think that's true for all emotions, actually. We don't want to increase arousal. If you're anxious and fearful, we don't want to become more anxious and fearful, right? That's just common sense. But a lot of times we end up becoming the emotion, meaning it takes us over, it hijacks us, and we just escalate or elevate that emotional state. We're actually trying to bring it down. Okay. Last thing he says here, Bushman from the study says, when you vent your anger, you're just practicing how to behave more aggressively. You hit, you kick, scream, and shout, and practice um, makes perfect regardless of the behavior. So it encourages more of that. So it's not very helpful. Um, Professor of psychology here at St. John's University, he's dedicated his whole career to anger research and said the myth of venting has persisted despite all the research debunking it. And here's a really powerful statement he says. We probably have over 70 years of research showing that venting isn't good for people. There's lots of studies, but it's a hard idea to kill. So I'm going to leave you with that. The data is here, and I'm sharing it with you today that what we want to do. So we have to learn to move away from exploding, getting it off our chest, getting it out. It's not helpful in the same way suppressing and holding it in and hiding it and pushing it down isn't helpful. There's a middle ground here. Remember, moderation is the key to many things in life, and that's what we need to learn is this middle ground. The second study I want to share with you guys today on anger was one that came out even more recently here um, in 2024 as well. And this one looked at science shows a surge of anger could raise a heart attack risk. Okay, and we've seen many studies before saying people who are angry people who are getting angry all the time, have increased cardiovascular effects, and that's been shown in multiple studies. In this particular study, um, done at Columbia University and Yale School of Medicine, St. John's University, a couple of universities were involved in this. They looked at 280 young, healthy people. So these were healthy people, young adults, four groups, control group that counted out loud for 8 minutes, maintained a neutral emotional state, uh, and groups who recalled events that made them angry, sad, or anxious. Angry, sad, or anxious. So three different emotional states. Um, and then the researchers took blood samples and measurements of blood flow and blood pressure in these people. Okay. And what they found here is that the anger affected the heart because of how it impairs blood vessel function. Okay. The ability to dilate. And the researchers found that the blood vessel's ability to dilate was significantly reduced among people in the angry group compared to those in the control group. And the blood vessel dilation wasn't affected in the sadness or anxiety group. So it was anger in particular that people were getting really angry. It affected their blood vessels' ability to dilate. And this can have an impact potentially in somebody with contributing to a heart issue or a heart attack. It did say that this is interesting. I always say how this doesn't cause damage. They said the further tests revealed that there was no damage to the endothelial cells or the body's ability to repair the damage. But the issue was the dilation, okay? Because you think of the emotion of anger, what it does cause very real physiological effects. All these emotions do. But the impairment in how the blood vessels dilate could be an early marker of atherosclerosis, okay? So we got to manage the anger and said, just like the last study I mentioned before, the results of the study could help physicians persuade their patients who have heart disease and anger problems to manage their anger through yoga, exercise, cognitive behavioral therapy, other established techniques. Okay. So we got to calm down, everybody. We've got to relax, settle, soothe. We got to also identify the emotion. We don't want to label it. We want to feel it. And we want to relax into and let it pass. There you go. There's emotion regulation in the nutshell. We don't want to blow up. We don't want to freak out. We don't want to make the emotion stronger, right? It just doesn't make sense. We want to reduce the emotional state that's been created. So we can do that through emotional awareness, labeling, identifying what we're feeling. Number two, calming down, relaxing while we feel the feeling in our body and let it pass. It will pass. It's a wave. We call these waves of emotions or clouds of emotions. They will go. And we sit through that. And then it settles out. What we don't want to do is react to the emotion, emotional reaction. okay, in negative ways, because that's just going to make it worse. So today I just wanted to go through and highlight anger here and how it's one big emotion that people have and we all have. It's a human emotion, but how we deal with it is the most important thing. You can't stop it from coming, but you can deal with it in healthier ways that will help you to reduce pain, somatic symptoms, protect your heart, things like this. If you like today's evidence of the week, please give it a thumbs up. It helps the channel grow, gets the word out to more people. If you haven't subscribed, please do. You get alerts when things drop here. Again, if you want help in learning to build emotion regulation skills, emotional awareness, please reach out. It's probably the biggest thing I can help people with in terms of building that awareness and connection to symptoms and how you deal with your emotions. And it goes a long way with how you're going to feel with these conditions and making improvements. Take care, everybody. We'll see you next time. Bye bye.